Medical professionals of Reddit, what is the craziest DIY treatment you've seen a patient attempt? Had a patient come into the with a makeshift bandage on his shin. He had fallen on rocks while hiking and left a 3-inch long, half-inch deep gash in his leg. I go to pull the bandage off, and as I'm peeling it away, I notice the skin is completely black, and there's dark chunks of fungus falling out of the wound. It looked necrotic, like it had been left alone for a week. I look at this guy like he's crazy, as he tells me the wound is only a few hours old. He's pretty proud as he explains that he created a makeshift poultice by chewing up leaves and moss, mixing it with river mud, and stuffing it into his leg. That's what all the black mossy stuff was. Hint: don't do this. Finally, something I can add to. When I was in med school on my family medicine rotation, I was sent in to see a middle-aged woman with complaints of sinus congestion. Sure enough, from the beginning, I can tell she's really stopped up with her nasally voice, and my history and exam are consistent with your run-of-the-mill viral upper respiratory infection. I begin educating her on symptomatic management, and the following exchange ensues. Patient: do you think it might be the flu? Me: it's possible but unlikely. It's really out of the typical season. It was June. Patient: yeah, I guess I wasn't sure it was. I've been spraying Lysol everywhere, and it doesn't seem to be doing any good, and it says it kills the flu virus. Me: well, that's something that could help disinfect the house and keep the virus from spreading. Patient: I guess. I just wish it didn't burn so much. Me: what do you mean, it burns? Patient: you know, when I spray it up my nose, it burns so bad. Yep. My patient thought that, since Lysol kills influenza, the best way to nip it in the bud was to flush her sinuses with it like a saline spray. It did not work, for the record. The fact that I didn't immediately fall over laughing, and instead seriously counseled her against ever doing that again, is still the greatest feat of composure in my entire career. Too long. Didn't read. When the label on Lysol says not for internal use, they mean it. Parents sneaking essential oils onto their premature baby's skin. They have central lines. These oils can wick onto the line and damage the line, cause infection, or interfere with medications. Infections in preemies can mean death within hours. Preemies have incomplete skin, with much faster absorption rates than fully developed adult skin. These oils can cause burns and damage their insides. Your pyramid scheme company is not a reliable source for neonatology treatments. Please, dear God, keep oils off of any baby, but especially preemies. I'm a dental student, where we see mouths in pretty or full condition. One guy came into the emergency clinic with teeth half rotted off from decay and told me he has been putting gummy bears in the holes to make it less sharp on his tongue. As a child, I got really bad sunburn. The person looking after me coated my sunburn in baby oil to help it heal and sent me back out into the sun. I realized when I was older why my mum went nuts. White bread soaked in milk placed on an armpit abscess to draw out the infection. Needed an IND and a couple weeks of 4th antibiotics by the time he got to us. Either that or the guy who crashed his motorbike scraped his leg all to hell and then decided the best course of action was to self-cauterize it on the tailpipe. Dental student here. We had a patient who declined a much needed cleaning, saying he could do it just as well at home with a scalpel. Didn't brush his teeth, but every few weeks he would go at the accumulated plaque and tartar with a scalpel. Same patient also insisted we do a procedure without local anesthetic. He was an amateur boxer and was building up his pain tolerance. He also told us he smoked 20 blunts a day and only drank Coke. We could tell. Worked in pediatrics for a few years, and we had this one family come in with a kid who was burned by one of those microwave ramen soups. They put duct tape on the now blistered skin to keep it from popping in the car. Not me, but my mom. Had a gentleman walk himself into the ED one day after he tried to give himself a vasectomy with an animal neutering kit he bought on the internet. When she asked him why, he told her that his wife wanted to have a 6th kid, and it was too expensive to pay a doctor to do it, and how hard could it be to DIY. Edit: I now know that it's relatively cheap to get a vasectomy, which makes this guy even dumber. I also now know there's more than one way to neuter an animal. Thanks guys. Edit 2. I feel I should share. He tried to cut his testicles out essentially. And yes, they did indeed put them back in the sack, and he could still make babies. I remember I was rolling in stomach pain and went to the doctor because my mom could not stop giving me chamomile tea all the time instead of actual medicine. It was not my stomach. I went directly to her since one of my ovaries was full of cysts and some of them exploded. Update. I took the Plan B pill and according to the doctor, those cysts were caused by the pill. I don't know what to think about that. Update 2. This year, it was my second time taking this pill. My body recognized the medication and did not have other reaction than my period coming 3 days before the estimated date. From now on, since I'm child free, I will save money in order to go to a clinic and having spay or neuter surgery. My grandpa thought a leg discrepancy was causing my back pain, which was causing spasms. He put several pieces of cardboard in my shoes to try to even out my legs, which were already even. He also thinks black beans cure everything. My dad thought those pesky spasms was a pinched nerve, so he would take me to the chiropractor, his girlfriend, to get my neck cracked when it happened. Seizures, people. They were seizures. Woman I know has a dog that is epileptic, but was not willing to medicate the dog for some time. She kept trying holistic remedies, one of which she informed me about was giving the dog all natural vanilla ice cream during a seizure to stop it. You know, because you should always try to put stuff in the mouth of a seizing animal. It didn't work. The dog is on meds. Seizures are controlled now. Imagine that. When I worked in ER, my colleague had to see a guy with an ear problem. He had something stuck in his ear and had been trying to get it out. This wasn't a new thing, he'd been trying for some time. Turned out, he had completely removed his tympanic membrane and the bits that were stuck in his ear and that he was trying to pick out with cotton buds and hair clips were his ossicles. Enjoy. Had a patient come to the ER for a cough. We did a chest x-ray that caught a little something in the abdomen or pelvis. Did a pelvic x-ray. Long story short, she stuck a shot glass up her vagina for birth control, left it up there long enough for it to calcify, and we had to surgically remove it. One time, when I was in nursing school, I was doing ER clinical and a guy came in with penile pain. Long story short, several days prior, he decided he wanted a penile texture implant to help enhance pleasure during intercourse for his lady friend. He and his buddy got drunk, of course, and decided to do it themselves. So they went in his garage and took a box cutter to slice open the skin on the dorsal top side of his penis, made some room between the skin and underlying muscle, and put a small porcelain heart underneath. Then he superglued it shut. To make matters worse, the guy didn't wait for it to heal and decided to take it for a test run. He ended up with a major infection and presented several days later. I unfortunately don't know the outcome. I was just there for the porcelain heart extraction. Can't make this up. I've now worked in a surgical or trauma ICU as an RN for 2 years, and people never cease to amaze me. Edit. Spelling. A man who'd accidentally sliced his leg open at his workplace. He obviously figured that, as surgeons use staples to close wounds, he'd cut out the trip to hospital and DIY with an ordinary desk stapler. Arrived in ED with a pus-filled wound with the odd discolored staple hanging off it some days later. We had a guy come in with an abscess on his right thumb. When I asked him what happened to his hand, he told me about his recent deep sea fishing trip and was given the responsibility of cutting the fish with an open wound in his hand. A sliver of fish got in there and became infected as it healed, so this guy gets the bright idea of doing a little DIY wound drainage by grabbing his pocket knife and cutting it open, leading to a greater infection. Still a student, audiology, but I had a very elderly patient come in with broken hearing aids. He said they were dirty, so he washed them in the sink with soap and water. Pro tip: hearing aids are not waterproof. Yes, he was warned of this when he first got the hearing aids. Thankfully he was still under warranty with the company, and they were kind enough to let him slide on this one. Otherwise that would have been $4,500 down the drain. Saw a young child, about age 6 to 7, with a bruised, swollen, crooked forearm. He had fallen on the playground 3 days earlier, and another parent there was a vet and had horse x-ray equipment in his truck. That parent took x-rays and told mom he was probably fine. So that was apparently good enough for mom, and she didn't do anything for 3 days while he was up all night screaming in pain. Finally she took him into my office and brought me the fuzzy copies of the x-rays, which were useless and impossible to accurately interpret. I got him real x-rays and an ice cast for his broken arm.